Hello everyone, and welcome back to MediInsights, unlocking the wonders of wellness. Today, we dive deep into Tadalafil Tablet, an essential medication that helps manage conditions like erectile dysfunction, benign prostatic hyperplasia, and pulmonary arterial hypertension. Wondering how it works, what the correct dosage is, and what you should know before taking it? Stay tuned as we explore its mechanism of action, key dosages, side effects, and critical safety tips to help you use it effectively and safely. Whether you're taking it yourself or advising a loved one, this video will give you everything you need to know. Uses of Tadalafil Tablet. In erectile dysfunction, it helps improve blood flow to the penis, enhancing erection quality during sexual activity. In benign prostatic hyperplasia, it relieves urinary symptoms such as frequent urination or difficulty starting the flow of urine. In pulmonary arterial hypertension, it lowers blood pressure in the lungs, improving exercise capacity. Occasionally, it's used for conditions related to vascular health. Next, dosage of Tadalafil Tablet. For erectile dysfunction, on-demand dose is 10 mg or 20 mg, taken 30 minutes before sexual activity. Daily dose is 2.5 mg to 5 mg once daily for continuous use. For benign prostatic hyperplasia, the dosage is 5 mg once daily, taken at the same time each day. For pulmonary arterial hypertension, the dosage is 40 mg once daily. Always follow your healthcare provider's instructions for the most appropriate dose based on your condition and response. Next, mechanism of action of Tadalafil Tablet. Tadalafil is a phosphodiesterase type 5 inhibitor. It works by relaxing the smooth muscles in blood vessels, improving blood flow. In erectile dysfunction, it boosts blood flow to the penis by blocking parade 5, allowing for stronger erections when aroused. For benign prostatic hyperplasia, it relaxes bladder and prostate muscles, easing urinary symptoms. In pulmonary arterial hypertension, it dilates the pulmonary arteries, reducing blood pressure and enhancing oxygen flow during physical activity. Next, side effects of Tadalafil Tablet. Common side effects are headache, flushing, dizziness, muscle pain, and indigestion. Nasal congestion and back pain are also reported. Serious side effects which is rare are sudden loss of vision or hearing, priapism, severe allergic reactions or chest pain. Next, important advice for using Tadalafil Tablet. Consult your doctor before use, especially if you have heart conditions, low blood pressure, liver or kidney problems. Avoid alcohol or grapefruit as they can interfere with the medicine's effect. Do not take with nitrates as it may cause a dangerous drop in blood pressure. If any severe side effects occur, seek immediate medical attention. Take the tablet as prescribed, avoid exceeding the recommended dose. By the end of this video, we hope you've gained clarity on the uses, dosage, side effects, and precautions for Tadalafil Tablet. Remember, always consult your healthcare provider before starting any medication. If you found this helpful, please like, share, and subscribe to MediInsights for more wellness tips. See you in the next video.